I'm a community pharmacist. Here are 3 things that you should watch out for when you're prescribing or providing an inhaler for someone. This is seen especially in COPD and our more elderly patients. They may have other conditions such as arthritis in their hands. They may have memory issues, so they might not be able to remember to take it twice a day if not prompted. Finding the best regimen and device for their lung condition is the most important. Number 1, simplify their therapy. In patients with COPD, because it is a progressive disease, oftentimes they are requiring inhaler on top of inhaler on top of inhaler. The doctor may prescribe just an add-on therapy where it's 1 medication per inhaler. All of a sudden, the patient is dealing with 3-4 inhalers that they need to juggle. They might not know what's short-acting, what to use for rescue, what's for maintenance. One is once a day, one is twice a day. As a pharmacist, it's so important to review this inhaler therapy, and that's what I love doing. Say, for example, they are on Symbicort, but then they're also on Spiriva. Now they're using one that's 2 puffs once a day, and then the other one twice a day, maybe 3 times a day, depending on how severe their condition is. There are inhalers that are 3-in-1. So the one that I really like are the Elliptas. This is not an ad, by the way. The Elliptas, they are easy to use because it's just a 1 click where you pull down and it loads the dose, and there's actually a counter at the very bottom. So if people have a difficult time seeing as well, it shows the dose right on the inhaler there to let them know when they run out. Elliptas are also very good because they are only once a day. All of those medications are long acting, so it's 24 hours, and they only have to do it once a day. The Elliptas also contain monotherapy, dual therapy, or triple therapy. So depending on where that patient is in their disease progression, you can easily switch them to one inhaler to another without needing to reteach them how to use a whole device. One that I often see that's prescribed, which is a triple therapy, so ICS LAMA LABA for COPD, is the Breztri. That one is done twice a day. However, this one can be quite difficult for older folks who have less dexterity in their hands, have weaker hands, they're not able to press the button or take off the cap as well. So in these situations, I like to prescribe the Trelegy, where you can just kind of pull down or kind of like push the cap against something to open it. Tip number 2, always watch how they're using their inhaler. Inhaler technique is so important. This is when you usually catch on if they're able to load the dose correctly or remember when to take the dose. Number 3, always make sure that they're aware of what is their maintenance inhaler and what is their rescue inhaler. Say they get discharged from the hospital, they don't get very much teaching, or they had to leave against medical advice due to circumstances, and now they're here with a bunch of inhalers that they don't really know how to use. This is a very good time to assess their health literacy. It may seem simple to us as healthcare providers because we literally learned this, but I remember before pharmacy school, I had no idea what was a maintenance inhaler and what was a rescue inhaler. And I think the longer we're in practice, the more we just kind of assume that our knowledge is a baseline knowledge. One thing that's very commonly missed is if they're put on a combination inhaler, they might not actually know that they need to rinse their mouth because it has a corticosteroid in it. They may think that they need to prime their Ventolin every single time that they use it. When they come in for an early refill, you're going, what's going on? Why are you using it so much? When in actuality, they're just priming it every time. Next, I'm gonna be doing a video about Spiriva or tiotropium. That one is a long-acting inhaler that is usually the first step when someone is diagnosed with COPD. There are 2 different types of inhalers. There's the Spiriva Respimat, which clicks, and then the Spiriva Handihaler. That is a pill that you put in, crush it, and then you breathe in the contents of the pill. Coming up next.